Hello, dear friends. Today we will discuss the examination of the ear. Examination of ear include the examination of the pinna, periodical area, postauricular area, examination of the external auditory canal, tympanic membrane, fistula test, tuning fork test, and examination of the ST2 function test, facial nerve function test. We discuss one by one. First, we start with the examination of the pinna. First, we look for the pinna, whether the pinna is present or absent. When the pinna is absent, known as a anosia. If the pinna is small size, known as a macrotia, and if the pinna is large size, known as a macrotia. We look for the size and shape of the pinna. Normally, the location of the pinna is identified by drawing a two lines, one from the supraorbital ridge and second line from the L of the nose. The pinna lies between these two lines. We look for the presence of any swelling, scar mark over the pinna, any tumor, any keloid over the pinna. The red and congested pinna seen in the cases of perichondritis, and when there is a cauliflower pinna seen in the cases of perichondritis, when the antihelix is absent, known as a bad ear. When the antihelix is more prominent than the helix, is known as a Baldwin ear. These are the congenital anomalies of the pinna. Some pinna is look forward and outward in the cases of furunculosis, and the pinna is forward, downward, and outward in the cases of mastocytitis. After the examination of pinna, we examine the periodical area. We look the periodical area for any periodical sinus, any skin tag, any fistula, any scar mark for the previous surgery, either present or not. Then we go on the mastoid. We examine for the any sinus scar, any swelling, any fistula, and in the cases of mastocytitis, normally the mastoid area is irregular in shape, but in the cases of mastoid, it becomes regular and smooth, known as a around appearance. This is seen in the cases of acute mastocytitis. We check the mastoid tenderness. There are three finger tests. One finger placed on the Simba concha, another in the on the mastoid center of the mastoid, and one finger on the mastoid tip. This is known as a three finger test. We check the mastoid tenderness. Mastoid tenderness in the cases of mastocytitis. Now we go for the examination of the external artery canal. The length of the external artery canal is 24 millimeter. The outer one third is cartilaginous part, this is 8 millimeter, and the inner two third part is a bony part. The examination of the external artery canal is done without a speculum and with the speculum. Without a speculum, we look for the normal size or dimension of the external artery canal, and we look for any debris, foreign body, any uh, polyp, granulation tissue. We assess the proper size of the external artery canal and then examine with speculum. The appropriate size of the speculum is introduced in the external artery canal, and we look for the any uh, wax, foreign body, any granulation tissue, any polyp is present in the AC or not. The next part for the examination in tympanic membrane. The normal color of the tympanic membrane is pearly white in color. The normal dimensions of the tympanic membrane is the anterior-posterior diameter is 9 to 10 millimeter, the transverse diameter is 8 to 9 millimeter, and the thickness of the tympanic membrane is 0.1 millimeter. The total surface area of the tympanic membrane is 90 millimeter square, and the effective the surface area is 55 millimeter square. The tympanic membrane make a angle of 55 degree with the horizontal, and we look for the any presence of any abnormalities in the tympanic membrane like a perforation or any other thing else. Normally the tympanic membrane is pearly white in color. It become red and congested seen in the cases of acute otitis media, and when sometimes the tympanic membrane looks like a bluish in color seen in the cases of hemotympanum. And there is sometimes there is a flamingo pink sign seen in the cases of otosclerosis. It's only present in 10% cases of otosclerosis. There may be whitish patch over the tympanic membrane known as a tympanosclerosis, chalky white plaque. Normally, the tympanic membrane is or the tympanic membrane is retracted, either bulging. The retracted tympanic membrane is seen in the tubal occlusion. The bulging tympanic membrane is seen in the cases of acute otitis media with effusion, or there is any mass behind the tympanic membrane. There may be a perforation in the tympanic membrane. The classification of the perforation according to the quadrant wise that a perforation either may be in the past tensa or in the past flaccida. In the past tensor, the perforation, if in single quadrant, is known as a small perforation. If involved two quadrant, is a medium perforation. If involved three quadrant or more, is known as a large perforation. If involve all the quadrants of the tympanic membrane, is known as a subtotal perforation. If the annulus is also involved, this is known as a total perforation. Then we go for the examination of fistula. Fistula test, we discuss the fistula test in the separate video, and also the tuning fork test is a very important part of examination because we can identify the type of hearing loss and approximately about the severity of the hearing loss with the help of tuning fork. We will discuss in the separate video about the tuning fork because tuning fork is a very important test. And we examine for the facial nerve function test. We ask the patient to show your teeth like E, to blow your mouth, to uh, chewing के लिए. Then we can examine the function of the facial nerve, clinically examine the facial nerve. And this is the part of the whole part of the examination of the ear. And station tube function test also very important function test like a wall solver test. Wall solver test is performed by the pinching the nose with the help of index finger and thumb, and ask the patient to blow your mouth and perform the wall solver test. And there are many other tests like polydizer test, tiny V's test, station tube catheterization test. Station tube catheterization is a invasive procedure we cannot perform nowadays, but many times ask in the Viva how to perform the stage tube catheterization. The station tube catheterization is performed by the we take the station tube catheter and pass in the floor of the nasal cavity, and when it reaches in the nasopharynx, it will rotate 90-degree medially and pulled outward. When it pinches in the posterior part of the septum, from where it will rotate 180-degree laterally, because the station tube out in the direction, and we connect a polytizer bag with the help of the we can increase the pressure in the ear and see with the help of the pneumatic speculum in the ear the tympanic membrane is moving. These are the important station tube function test. We will also discuss this important test in the separate lecture. This is the all about the examination of the ear. In the next lecture, we will discuss about the examination of the nose and the paranasal sinuses. Thank you.